We have a list here of some specific conditions. So, doctor, can we go through some of this? We talked about a few of them, you and I, as we were watching this package. The big ones seem to be attention deficit and hyperactivity disorder and autism spectrum disorder. Can you chime in on those, please?
Yes, so with ADHD in particular, attention deficit, what we really see are those kiddos who have a hard time sitting still. We might see a lot of impulsive type of behavior. We might see a lot of inattentive. So when we have them, if we think of the library and where they do circle time, we might see that those kiddos are moving around a little bit more or have a harder time paying attention. With autism spectrum disorder, what we're really starting to see are those social deficits and language deficits. And oftentimes those children will also have or may have some type of communication disorder or language disorder as well.
I know we're going to talk about it in our next segment, but could you quickly tell me what's the difference between ADD and ADHD? I mean, is it the same thing? It
is. It's really a term that we currently use ADHD, and then we just specify which type it is. We have hyperactive, inattentive, and combined. Your inattentive is what commonly people know as ADD.
All right. A big question here. Do we know what causes developmental disability?
So what we know and what we understand at this point is that it's a neurobiological process. So it's oftentimes may be influenced by genetics and the parental loading. We may see that also it may be influenced by age of parents at conception. But oftentimes what we know at this point is that there is a brain function behind, or a brain dysfunction, for a better term, behind some of these disorders.